Okay, welcome everybody. Thank you for coming today for this panel discussion. And I want to welcome you on behalf of LA Mission College. My name is Dr. Monty Perez, president of LA Mission. We are expecting more students that seem to be streaming in, so they'll get here. We are all very interested in making sure that we prepare our workforce in the health sciences area, in the allied health area and healthcare. That remains one of the significant clusters of employment growth and employment needs throughout the country, and particularly in California and in Southern California. And I know that Marla we're part of a consortium, as in Northern California, with other community colleges and workforce centers in Orange County and LA County. We meet monthly, and all the deans meet, and the presidents are involved with the idea of working together on regional solutions, one of which is in the health care area, as well as in information technology, multimedia, logistics, manufacturing, to name a few. But healthcare continues to be a strong driver for community colleges and for colleges as we prepare the workforce. The other comment I want to make, and then we'll get started, and I'll ask Felix if he wants to say a few words, and then we'll turn it over to you, Janelle, because you have a major presentation we all want to see. The comment I wanted to make is the state of California has invested quite a bit of money in trying to prepare the workforce of the future. We know by 2025, we're going to need 1 million more baccalaureate degrees awarded to Californians. The whole interest in terms of moving our higher education institutions, but quite a bit of money has been invested in community colleges in the last 5 years with career pathway money to get high school students to have pathway to colleges for the workforce. But most recently, strong workforce funds to create regional solutions, regional cooperation in all the different counties throughout the state of California. So we have been charged as community colleges to really pay attention to the workforce demands of our economy. So having said that, we're very interested, and I know Kathleen and I are here because very interested, and along with Chafee and everybody else, on how do we partner with a company like Dignity Health and other companies in terms of making sure our students who graduate, complete licenses, certificates, and degrees can get the kind of training they need with you and be prepared to be long-term productive employees. So having said that, I'm going to ask Felix if he has anything he would like to add, and then we'll get Janelle Washington and get started. Felix?
Thank you very much, Monte, for having us host this great event with Dignity Health. Just to give you a little background, I know Marla does a very good job with workforce and strong workforce and all that good stuff. But oftentimes we see, and Janelle's here as well, from Dignity, the disconnect between employers on the skills that they're focused on and what the colleges are actually disseminating from a programmatic standpoint. So today, the World Economic Forum, this morning, I guess, late last night, PST, came out with a study around the future of work and how the fourth industrial revolution is occurring and how many folks are going to be left out and income inequality is going to continue to rise. And that's unfortunate, and truly, that's where community colleges in partnership with employers can create and solve for that income inequality. So the purpose of this discussion is really around the future of work related to healthcare. Janelle will give a great presentation, and then we'll just dive into discussion on how community colleges and employers, through data-driven situations can enable greater outcome for students and greater mobility in their income. All right, thank you.
So again, hello everyone, I'm Janelle Washington. I'm the Director of Talent Acquisition, and I support our Southern Cal market, our Bay Area market, and our Central Coast market. And what I wanted to do today with each of you is talk about some of the things that are occurring in healthcare and where the focus on talent is shifting. So there are things in healthcare in terms of some of the challenges that are happening today, and you hear in the news, that are really causing the shift in the type of healthcare workers we're looking for today. So we're going to talk about the top challenges facing healthcare delivery. We're going to talk about how technology is changing healthcare and the skills required, how healthcare delivery is changing. Well, I'm going to give you just a brief overview of the job outlook. And as many of you are probably aware, our nursing and allied health professionals are fully employed. So our experienced nurses and allied health workers are fully employed, so they're in high demand. And then I'll share with you some of our insights in the Southern California market on just our recruitment volumes. So let's start off with some healthcare trends. So I wanted to put together this chart, and actually this is some research that's been done by Deloitte. I like to look at a lot of Deloitte, Burson by Deloitte's research. And these are some of the top things that are changing or shaping healthcare today. Shaping the workforce of the future, the demands of the workforce for the future and what that looks like, the skills required. Hospitals and delivery systems are trying to create a positive margin. So as you hear, just the cost of healthcare is rising. You see a lot of healthcare systems, standalone hospitals, merging just to stay alive. And recently you're seeing a lot of health plans and pharmacy organizations combining. Policy and regulations are really shaping healthcare too, so we're kind of in some turbulent times with a lot of uncertainty in regards to healthcare policy. And technology. Technology is really starting to really shape the skills that are required in healthcare. So that's changing. That should actually have an impact on the training that happens in our local schools. And then just the shift of volume to value. So this is now a consumer's market for healthcare, and so there's a lot of demand on healthcare systems just to make sure that the delivery of healthcare has a quality component. So a lot of consumers now can see healthcare systems and how they rate in terms of patient care outcomes and quality. And then just improving the patient experience. So inside many healthcare systems, patient experience and patient outcomes are just on the forefront. That is a top priority for healthcare systems because, again, consumers can now see outcomes in healthcare delivery in different systems. So despite the challenges, the healthcare industry still remains strong and is expected to remain strong throughout 2018. Again, we have an aging population, and this is going to continue the demand of healthcare workers, and policy changes are going to continue the demand of healthcare workers. And many healthcare executives are hyper-focused on just how they are going to obtain healthcare workers. So we know that there's a huge shortage in healthcare pools of talent, and so there's a lot of optimism that we will have the skills needed at the pace that the growth of the demand is occurring. So I'm going to focus on some major top concerns: rising cost of healthcare, difficulty again finding top talent, the economic outlook, a lot of uncertainty with policy, regulatory burden. There's a lot of regulatory burdens within the healthcare delivery system in terms of just how we deliver healthcare, the type of, we have a lot of regulators that audit patient outcomes, medicine delivery. There's a lot of different regulatory burden on the healthcare system. For those that are for-profit, there's a tax burden. And then again, if there's any type of sentinel events in healthcare hospitals or nursing homes, there's a lot of scrutiny around that. And again, I want to focus on technology, because technology is really advancing at a rapid pace. And so when we look at the skills of the workers that are out there today, many of our new grads that are coming out of different programs aren't equipped with the technology skills that are needed as we continue to advance in healthcare. Many healthcare systems now are using an electronic medical record, and I can tell you, when we first went live with our electronic medical record, a lot of our physicians weren't ready. A lot of our nurses weren't ready for the electronic medical record. So these are things that are going to shape the type of skills that are needed. Robotics is another skill that we find a lot of our healthcare talent out there are limited with training. And then we're looking at a lot of virtual healthcare practices and healthcare delivered in the home. And we don't have a lot of talent that are equipped with these skills coming out of their different programs. And so this has a huge impact on hospital systems to conduct that training internally. So digital technology, robotics, automated tools, these are things that at the JC level and even at the baccalaureate level, these are different skills that will assist a lot of our healthcare systems to ensure that we are hiring the talent with the skills that we're going to need to deliver healthcare in the future. And as technology is changing the healthcare delivery system, the way that we provide healthcare is changing. So as you can see, there's a shift. In the last 10 years, most of healthcare delivery was done in a hospital. Now that there's a shift, it's more in an outpatient and long-term setting. So with that shift in how healthcare is delivered, there's going to be a shift in the types of healthcare workers that we will be employing. So again, home health, hospice, home health aides, these are different skills that are in demand. There's a huge shortage with this population, and as you can see on this chart, outpatient services and long-term care are now rising in terms of the delivery of health care. Okay? I'm going to pause for a second. Are there any questions? Is anyone kind of shocked by this information? Okay, so let's talk about job opportunities. So for most healthcare organizations, and when you look at recruiters, 53% of healthcare employers are expecting to do more than 40% of hiring in the next 6 months. Okay, 1 to 10% more. And then 28% of healthcare organizations that were polled expect to do 28% more hiring. So there's a significant requirement for healthcare professionals. And the intent to hire in the first half of 2008 is going to be much higher than in 2017. So there's a lot of opportunity in healthcare. Then when you look at nursing and allied health professionals, so this is from the U.S. Bureau of Labor and Statistics. And as you can see, RNs and allied health professionals are a fully employed population. So when you look at the number of employment in the different health care jobs, you see that this is a fully employed population. There's only less than 1% in many of these categories that are unemployed. So when you look at respiratory therapy, this is a fully employed population. And when you look at even hospitals when we can't find the talent and we're required to look for travelers or temp talent, there's even less than a 2% availability of temporary workers in these groups. The same with, and I've highlighted some of these categories because these are critical opportunities that we're seeking in Dignity Health, okay? So, these are great opportunities for many of the students that are interested in fulfilling some of these healthcare careers in a junior college setting. These are some of the professions that are in high demand, and there's an extreme shortage. If I can continue clicking, I can highlight the other ones. Nursing. Clinical lab scientist. Clinical lab scientists, the average age of a clinical lab scientist is 69. So when we look at the extreme shortage that will exist in the next 5 years for clinical lab scientists, and the number of clinical lab scientists that are getting licensed in the state of California, we have on average, about 12,000 per year that are getting licensed in the state of California. But we have more exiting the profession, okay? And most hospitals that are looking for clinical lab scientists, these positions remain open over 6 months, okay? So this is a great profession for healthcare, people that are interested in healthcare. In addition to rad techs, and I don't know if you guys are familiar with radiology technologists, but these are the x-ray techs. They do the x-rays in the hospital, and there's an extreme demand, especially within Dignity Health, for rad techs. Okay? And again, as I point out, you see all of the positions on this chart, when you look at the unemployment rate, all of these positions have an unemployment rate less than 1%. So I want to call that out. Okay? I'm going to try to come over. Okay. So I want to just kind of open it up. If any of you have questions that I can answer for you, please ask me any questions that you have at this time. Yeah, so the ones that I circled on that chart are the ones that are extreme shortages within Dignity Health. Yes. Any other questions?
So the list of professions you just listed, do some of those job types tend to go between companies as opposed to being permanent employees of a single company? They have their own independent practice.
What we typically see is that a lot of those professions, if they're not interested in hiring on with a specific employer, they will join a travel agency and they will sign on for limited contracts. So there's an extreme demand for travelers. And as I mentioned, even with traveling agencies, many of these professions, there was a 2% availability, less than 2%, even with traveler agencies. And when we have vacancies in our healthcare systems, we rely on securing talent from traveler and registries. And as you can see, there's a critical shortage even among those groups as well. Any other questions? So let me ask a question of the group. Are many of you interested in healthcare as a career? I see some heads nodding. Okay. And does anyone want to share with me what you're studying at this point? Okay. Okay. Okay, and that's a good profession because, as I mentioned, there's a huge regulatory burden on healthcare systems. So a lot of healthcare organizations are also looking at quality assurance, utilization review coordinators, because they're assessing the healthcare that is administered to a patient, was it medically necessary? Okay, and so those are jobs that are going to be significant in the coming years, and many healthcare systems are planning for those roles as well. So that's a good profession. Any other questions? Public health is a good profession in nursing. It just depends. Do you want to work? Do you want to do research? Do you want to work in disease prevention? Have you really kind of narrowed down what are you going to do with that public health nursing, that route in public health? I can tell you nursing, OR, operating room nurses, labor and delivery, ICU, those are critical positions in nursing. And what I would recommend to you is that many hospitals still will enable you to volunteer. And if you haven't already done so, volunteer in a hospital so that you can get a feel for the different departments and the different opportunities that exist in a hospital system. Okay? Any other questions? Don't be shy. So laboratory scientist, that actually requires a higher education. So you would have to obtain more than a bachelor's degree. There's more of an educational requirement for clinical lab scientists. And the challenge with clinical lab scientists, I don't want to say the challenge, California, the licensure in California is a little bit more stricter than many of the other states. Again, great profession, and the demand is there. You will not be unemployed as you saw on that chart, but it is something that if you are seeking to be a clinical lab scientist, you will have to continue your education beyond the community college level. Okay. Physician assistant. So physician assistants are similar to nurse practitioners, and a lot of health hospital systems prefer to employ physician assistants, and there are programs where you don't have to necessarily get a master's in nursing, but you can actually go through a physician assistant program, and it's pretty much equivalent to a little bit more than a bachelor's degree. You're still getting a bachelor's, but you're going through a specific program for physician assisting. What I would recommend is that if you are taking classes here, make sure that you're taking classes that will align you with what's required as prerequisites for that physician assisting program.
Thank you.
Okay. Any other questions?
Are there ever opportunities for internships with a company like Dignity, or people who are still earning their degrees or going through their coursework?
So that's a good question, and that is actually the reason why I am here today, because we are really starting to grow our internship capabilities. We have heavily relied on experienced talent, but as you can see, the shortages are there. And so healthcare systems are now getting to a point where they can't just rely on experienced talent. So we are developing more internship programs within the organization. When we do that, there is a requirement in many cases, like when we have nurses that come and do their preceptorship, or they do a new grad training program. We have to take staff to where they're shadowing staff, and so we haven't really developed the number of internship programs that we would like, but we are in our infancy and we're really developing those programs. So there's more to come, and we're really looking within the organization at where our real critical shortages are across the organization, so we can develop programs to attack where we have our critical demands. So we're not totally there yet, but I would say that we're heavily focused on it, and we do have committees that are working on internship programs and developing where those programs will be. So more to come. I hope to come back and share opportunities shortly on where you can apply for different internship programs. We do have cybersecurity, and I'm glad you brought that up. I didn't focus on some of the high-tech roles, but cybersecurity is big in healthcare, especially with the electronic medical record and a lot of the sensitive data, the protected information that healthcare systems have to manage. And so cybersecurity roles are really big now in healthcare and will continue to grow in the healthcare sector. So those of you that may not be interested in patient care, but you may be interested in healthcare, the healthcare sector, and may be interested in high tech, cybersecurity is going to be on the rise. Any other questions? No question is a wrong question, and I'm sure that there are other questions out there. And again, the group that I manage is on the hiring end. So as you exit your programs, you'll be contacting people on my team for opportunities. So, this is a great opportunity for you to ask questions and find out, what it is in healthcare, what you need to, kind of be focused on, where the opportunities are, and if there's anything that I can help you with in terms of volunteer programs and different things like that, this is a great time to ask those questions. So this is not the time to be shy. That's a very good question. Dignity Health, we hire individuals that have second languages, because again, healthcare, we're delivering healthcare to all communities. And so we don't specifically hire individuals that are bilingual, but if you have a bilingual skill, then of course we will do the assessment that you can, because there is a regulatory requirement that we have to make sure that you're able to interpret from a healthcare perspective. There are organizations, healthcare systems, that do hire specifically for bilingual, and that is huge, because in the past, a lot of healthcare systems outsource that. So there were a lot of language relay lines that healthcare professionals would utilize when they had a patient and they didn't have anyone that could speak the language. Some healthcare systems are bringing that in, so that if that is a skill that you have, then you would definitely want to make sure that as you're applying for different positions, you look for those positions that are bilingual. We don't hire specifically for bilingual, but we do love to hire people that have that skill, and there is a premium pay for that. For bilingual? We're really building that, Felix. So We have internship programs right now for high school students. And so what we have found is that we're really trying to get in front of high school students as they're really making their decisions on their college career track. And so we're still working on programs for college students and specifically for programs that are outside of like a clinical rotation. Right now, most of the internship programs that we have, or somewhat internship programs, are clinical rotations, which are required through the schools and different programs. And we do have various opportunities for new grad training programs. So once you've fulfilled like a nursing degree and some for imaging, so radiology technologists, then we do hire some interns, but it's very limited at this point. And our leaders are working on clinical curriculum, because once you come out of your program, you're a new grad. And you really don't have the experience in the hospital other than your clinical rotation. And so there's additional training that needs to take place before you deliver care to a patient. And many of our job descriptions and many regulatory requirements require when you come out and deliver patient care that you have 1 to 2 years of experience. And so what we typically try to do is offer a new grad training program in different job categories where we're training you to get that experience where you can deliver care independently. So we're not 100% there, but I'm not going to be selfish to just talk about Dignity Health. I am going to share with many of you there are a lot of healthcare systems that are offering internship programs and new grad training programs, and you want to be prepared for that. You want to be prepared and make sure that what you're learning in school and where you're doing your clinical rotations, that you find out, is there a training program in that organization that once you graduate, that you can come in as a new grad and have an opportunity.
As far as like administrative positions, how are administrators that have clinical background? And thank you. And if so, what specific like degree or certificate would you recommend somebody to have?
So, I'm sorry, I didn't hear all of the question.
So like if I want to pursue an administrative position, I would assume that it's good to have a clinical background. What certificate would you recommend, or what specific clinical like area would you say it's good to pursue in order to have like that competitive edge as like to be an administrator as well?
Like an administrative assistant or something like that?
No, like a director or something like that.
Oh, okay,
Yeah.
good question. Typically what happens when you are seeking those executive or director level positions, they typically look at people that, and I can speak to some of our clinical background, positions that require a clinical background and their directors. I'll use nursing, for example. Our nurse directors require a master's degree. So they are looking at Dignity Health. And the reason being is because our RN directors are the career pathway for our chief nursing execs. And there's a regulatory requirement of from the Joint Commission that chief nursing officers have a master's degree. We're starting to see a change that for leadership roles, you need a minimum of a bachelor's degree. And so it just depends on if you're going into a clinical background, if you're going into an administrative background where there's no requirement for a clinical license, but at minimum it's a bachelor's degree. Any other questions?
In the offices, administrative work in the field, like perhaps coding, and what they do in hospitals. I know that a lot of people are interested in pursuing that. How does one get started, and where are the opportunities for that?
So that's a good question, because there are coder programs out there, and there's certification programs, and typically, we can't hire you unless you've fulfilled the training and the certification requirement. I think it's HRIT, if I'm not mistaken. Don't quote me on that, and I hope that's not on camera. I can't remember all the license requirements verbatim. I deal with so many. But there is a certification requirement for coders. And there is training. And so because coders are also in demand in certain markets, we do some training for coders. And so that's another great opportunity for individuals that aren't interested in going and pursuing a bachelor's degree, and interested in maybe doing a certification program or completing an associate's degree. That's another great opportunity for students to pursue that type of job, career. Any other questions? I can share with you that for years I would speak to high school students, and the first question I would ask many of the high school students, I'd ask them to list the different types of jobs in a hospital. And, some would get as far as pharmacist. But there were a lot of opportunities in the hospital that a lot of students aren't familiar with. And there's so many different opportunities in healthcare. It's just one of those industries where you can go from anywhere from finance to food service to administrative, to actually delivering health care. And, everyone is not interested in pursuing a bachelor's or a master's or a PhD. And some of our clinicians are required to have a PhD, pharmacist, physical therapist. So there are a lot of healthcare professions that are required to have higher level of education. But there are healthcare professions that there's a certification program or there's an associate's degree. So again, ultrasound techs, radiology technologist, respiratory therapist. These are all professions that are in high demand that you can fulfill at the community college level, and they provide a pretty rewarding income compared to not coming out with a skill. So I would encourage many of you that are students here today that if you haven't already volunteered or done some type of shadowing in a hospital and you're interested in going into healthcare, to partner with one of your local hospitals and go through volunteer services so that you can get a better grasp on all of the different opportunities in healthcare. And I'd love to talk to many of you after we finish the panel, that if you have any additional questions that you may not want to say in front of everyone, that if there's anything that I can help you with in regards to the many healthcare career pathways, I'm more than happy to share what I know and give you any insight on the wonderful opportunities in healthcare. Again, I tell people as we're recruiting them, because I'm on the recruiting side, that when you go into healthcare, you're not just taking a job, you're really changing lives. And you're creating the future. And healthcare is on the forefront. We hear about it every day on the news. And so this is a great career, and it's needed in our communities. Okay? So, if there's no other questions, Felix, I don't know if we want to start the panel or... Okay. All right. Well, thank you for your attention. And again, I'm available if you have any questions after we do the panel. Okay, thank you. When we actually had the nursing shortage really begin in California, when they changed the nurse-to-patient ratio, we were required to go to places like London and the Philippines and Canada to recruit nurses. What we found is that Canadian nurses were coming out with more skills because they had more clinical hours, less didactic, more clinical hours. So I think the onus is on a company like Dignity Health to provide more of the clinical rotation and the clinical training and observation hours, and really partner with schools so that the curriculum, their students are prepared to take on the more clinical hours in the hospital setting. And that's specifically for nursing. But there are also other opportunities in healthcare, as I mentioned earlier. There are the technology components. We have a lot of the baby boomers that are retiring because they don't want to deal with all the technology that they have to deal with today. I saw my pediatrician before, the end of last year, and she said she just didn't want to deal with all of the electronic medical records and all of the technology she was required to deal with. She's been a physician too long. And so our seasoned professionals, this is a new learning for them, and they're not interested in learning some of the new technologies that are out there. We need to really partner with schools so that as we are employing our next generation of talent, that you are coming out, students are coming out equipped with the new technology demands and the new technologies that you'll be utilizing when delivering healthcare or working in a healthcare setting. So I think, again, and I'm long-winded, I know, but that's why I'm in recruiting. I think for the most part, it's really going to be a partnership with our clinical education departments, as well as the deans or, the heads of curriculum development at the community college level to really develop those curriculums together.
Great, thank you. So first of all, thanks for joining. What's your name?
Christopher.
Awesome. So tell us a little bit about yourself.
Well, my major is nursing. I've been at this community college for 2.5 years. What initially got me into nursing is my dad gave me I think it was when I was 8 years old, he gave me a giant first aid kit. And I thought it was in like an Xbox or something. So when I opened it, and it was a first aid kit, I was like, what is this for? But he told me to look inside of it because my dad originally wanted to be a nurse or a doctor. But when he was born in Mexico, he had to join the army. So he never got that chance. So he gave me that first aid kit, and I started to learn how to properly apply a Band-Aid, stuff like that, what is an antiseptic, stuff like that. And to be honest, upon watching YouTube videos, and then in the recommended section, there's live surgeries and stuff. And I saw it, and at first, you're a little kid, you see that stuff, you're like, I thought it was a cartoon or something, but eventually I asked my dad what that was. He told me to keep watching those videos, like surgery, open heart surgery and all that, and I did. And eventually I got interested in that. I was too young, I was like, Dad, what job is this? And he's like, well, that's a nurse or a doctor if you're interested. And initially that wasn't what I wanted to do. I wanted to be an architect. But I still have that first aid kit today. It's all broken, but I still have it. But that's what initially got me into nursing, being able to heal people and know what things do when they don't know, how to heal themselves.
That's awesome. That's a great story. So what has your experience been on that journey into the nursing program, and where have been the best, success stories, and where have there been a little bit of a pain point that can be improved? Yeah, along the path. Yeah.
Okay, so I know when I first started taking the prerequisites and all that, when I was recommended, that's when I really started to see if this was something I'm interested in, because it seems that the instructors, they tell you what you need to know, but along the way, unless you seek it, there's not really any, this is how it is, when you're actually there. And then that you guys were talking about, the technology is evolving. We don't really talk about that in the classes. This is how things are now. We just talk about what you need to know. But where I found myself confused is that I go to hospitals that say someone gets admitted and you see all this technology, and I have no idea what it does. I've never heard about it in my classes. I've only heard about your arteries and stuff like that. So I don't know if that's something that happens when you're there, training. But I was wondering if there was any classes that could be offered here, about stuff like that. So, because it seems like when you're done with your classes, you get admitted into a program, and there's almost a catch-up kind of phase that you have to do to get more formal with their technology. I'm not sure where those mix. I'm not sure if there's only people that only focus on the technology spectrum of it. But it's just more I had this professor, her name was Dr. Parr. She's been She works over at the CMS. We have a building over there. And she was really the one that gave me like the most inspiration, because she gives us, she would give us many like flyers on programs we could join over the summer, stuff like that. And it's some of the courses, they really like challenged me. This past fall, I took microbiology. That was probably the hardest one for me. And it's like when classes like that push you, you really see if you want it bad enough or not. But as far as I can say, like my experience with that path here in the community college, it's been pretty much what I anticipated. Yeah, and I've had a lot of people, like my sister, she's also interested in nursing. She's about 4 years older than me. She's already doing her clinicals, but me and my sister don't really have that connection that we talk about. We share that stuff, so I don't know who to go to sometimes, you know?
So you're missing the mentor ship. Yeah, interesting. So I guess, Dr. Perez, in the case of the mentorship, how can community colleges work with employers to enable that as part of a strong workforce program?
Pardon me. I think that partnerships with the hospitals have to take place. Sorry, my throat's plugged up. But I think what Janelle has said is important, that we send our students to work over there as part of their training so they can actually see what's going on. I think what Dr. Parr has talked to me about is to make sure the students, when they're taking the prerequisites, they really want to go into healthcare. Because some students think nursing is one thing, and then when they start taking the courses, they realize, maybe this isn't what I want to do. So she encourages students, and I think thank you, Terry, we need to encourage students to actually go to hospitals, to actually see what occurs, and perhaps even observe treatment that takes place. Because some students can say, I really like the science of it, but I don't like this aspect of it, you know?
Yeah.
And that's an important determination to make for careers. So she has encouraged students to early on, is this really what you want to do?
Yeah.
And then those that see it, in your case, luckily you watch YouTube, so you've seen a lot of things, can say, yeah, I actually want to go into this field. So that's important. But I think the key is early on, even in the freshman year, first year, is to get the students to actually go to a hospital or a clinic to actually see treatment, you know, at the appropriate level.
Yeah.
And then they can say, oh yeah, that is what I want to do.
Yeah, so Janelle, you brought up that, you know, your focus on entering or meeting high school kids. And so one thing was mentioning about the freshmen. So in the case of a student interested in healthcare early on, they may not know, they may not have watched YouTube videos, but they may have seen it, you know, on ER or 911 or whatever. Would Dignity be open to allowing these students who might be interested in this pathway to come in earlier? And it wouldn't be in the form of an internship, but a day in the life of Dignity Health, and what that looks like just as part of the career pathway exploration.
Good question. Can you hear? Okay, good question. And I wanted to share a story, but I'll answer that question first. We have a committee that we're working on that. So we have a 3-year, and I should have mentioned this earlier, we have a 3-year roadmap where we're building internships throughout Dignity. And we want to make sure we have it in pockets. So our Sacramento market is really providing a lot of the internships, but we're trying to actually spread that across Dignity Health and not just have it in pockets. But I want to just share a quick story because I was listening to a story and it just brought me back to when I was 18 and I was getting ready. I was actually a nursing student and I was actually getting ready to go into the nursing program. I don't think, Felix, I've ever told you this story. And I volunteered at one of our community hospitals. So this is where I said, I'm going to choose this hospital because my parents, they were friends with the administrator and he was I got a mentor. So I found a mentor and I came in through the volunteer program. And I wanted to be down in the emergency department so that I would see everything. They had gunshots. They had, this was a trauma center. And I was there one day, and they were so busy that this homeless man came in, and he was a heroin addict, and he had a thyroid problem, and he was foaming at the mouth. And it just stuck with me because, they were just saying, deal with him. And I'm this 18-year-old not knowing what to do, and everything was moving so quickly. I just said, this isn't for me. This is just I can't deal with, all of these sick people coming in and so forth. But I knew I wanted to be in healthcare, and I really wanted to be in a sector that has an impact on the community. So I went into my dean and changed my major right before I got into the BSN program at the college that I was attending, the nursing, the nursing program. And I had finished all of my prerequisites and had struggled to get through everything, microbiology, medical physiology, all of those, epidemiology. I took all of those classes up all night doing that and changed my major. And now I'm in human resources, and essentially went back years later and got my master's in human resources, and I teach at the college, at one of our colleges in San Francisco. But needless to say, had I not gone in and volunteered and really experienced what it was like really in a healthcare setting, I would have finished my BSN and probably burned out in nursing. I do want to say this, though. One of the things that I wish that I would have known was all the different nursing careers that you could choose. So for those individuals that may not be interested in staying at the bedside, there's case management, there's medical review, there's a lot of different career tracks that you can even take at the nursing level. And so I would encourage you to get that experience. Just volunteer in a hospital and get a feel for what it's like to work in a healthcare setting.
May I add to that? We talk about high school pathway programs, and I think high school students need that exposure as well. And Christopher's story is interesting because you talk to high school students, they have totally unaware about the medical field, the healthcare field, all the things you just said. And they know what a doctor is, they know what a nurse is, but that's about it. It's like they know what a lawyer is, and these 2 or 3 occupations. But when you talk to them about all the occupations in the medical field, they're amazed. It's like brand new information. No one's ever told them that. So we need to find a better way at the high school level and the college level to make them aware of all those areas. Maybe a partnership with Dignity Health and others on doing forums. And we have career centers that are full-time trying to assist students to look at a variety of careers. So our career centers could be the link to provide all that information. Sorry. Thank you.
Yeah, so Christopher, so you're a student, you're here. Have you done any volunteer programs, or are you interested in doing volunteer programs?
Yeah, I'm interested in doing volunteer.
Well, you're right next to Janelle. Get her number and.
And I was also going to say, just to add what they were talking about, I think the most important thing, like I was saying, is exposure, especially really early on, because I had a friend. She was part of the nursing program or nursing major. Probably like 2 semesters ago, and then she started doing volunteer work, and immediately she was like, this wasn't for me. I feel like I wasted my time. It's like 50-50. I'm not going to say it's all on the schools, because students should also go out of their way, if they want it, to volunteer and get exposure to that. But I think if anything, it's better to have that safety net of the college already offers it, so now it's up to the students, But I think exposure is the most important thing in this field of work.
Felix, can I say one thing? And the purpose of this panel is not to scare you out of healthcare, because again, the purpose of me mentioning all of the different career tracks that you can take in healthcare, there's so many different career tracks that you can take. I'm still in healthcare. I love healthcare. But the purpose of what we're sharing is that really, get that volunteer experience so that if there are things that you're seeing in the hospitals, take it back to your counselors or your professors and share with them some of the things that you're seeing that may not be a part of your curriculum, because that helps your local colleges help shape the curriculum and the things that you're receiving through your education. So, take a little bit of ownership as well in regards to getting, the training that you need while you're in school. This is a great time. I enjoyed being in college, and I enjoyed talking to my professors, and I'm sure a lot of your professors would love to get your feedback on what's happening in the healthcare field. It's changing at a rapid pace, as everything is changing. I mean, does anybody out there remember Kodak? Does anybody remember Kodak?
Yeah.
No, because we use iPhones, right? We take pictures with our iPhones. And so that's an example of when we don't evolve and things don't change at a rapid pace, it's non-existent. And so, again, this is your school, and so be a part of it and share, feedback on what you're seeing as you're doing that volunteer work or internships. Take that information back to your professors.
I guess one question, do we have any veterans here? Any military veterans? Okay, so you guys are in high demand.
Yeah.
Maybe Janelle, do you want to speak a little bit about the veteran focus?
Yeah, there's a huge veteran focus, and I know the organizations that I've had the opportunity to work for, many organizations have about a 7% employment push for veterans. And so, make sure you share that information as you're applying. Although we can't see it, and there's nothing that we can really do with it on the front end, organizations are doing a huge push for veterans. So, that's great that we have some veterans out there.
I was a veteran too, so awesome. We'll be closing here out shortly, I guess. To start with Christopher, what would be the advice you give to your fellow classmates on what's the best career pathway, and what learnings do you have? I mean, your dad's story is inspirational, pretty amazing. How would you recommend that you help other classmates understand what they want to do within healthcare?
I think it's important to have pretty much meetings like this, because I know there's probably people who have questions they're kind of too shy to ask. It's important more than anything to come out of your shell, and if you have any questions you need to ask them. That's the only way to find out. Like she said, no question is a wrong question. To get experience, even if it's just watching videos on the things you might like. And I think another thing is, when you're taking all these courses, is an important time to see if you really want this, because you need to see if it's not supposed to feel like it's draining you. It's supposed to feel like you're energized for this, you want this. If it's making you feel otherwise, we have counselors here, they're more than happy to help. I know a lot of my friends don't speak to their counselors. They kind of think they can do it on their own until it's too late. So I would suggest we offer these resources here. There's a STEM center. Seek out those resources, and I think the payback will be incredible, for the students.
Yeah, awesome. So Janelle, so you have a lot of advice that we can take from you. A couple of things. Based on your experiences, obviously, your background and where you grew up, and that experience in the hospital. How can you apply that? How has that been applied today in your role as Director of Human Resource? And most students that come into community colleges, or they haven't had that exposure, right, to understand that they can be an executive. I think someone asked, what can I be? How do I become an administrator? How do we think beyond the fact that I just want to be a nurse or a technical position? Because ultimately, maybe I can be the CEO of that hospital. So that's one question. And then the second question, So, it's January, and I guess we have to get permission from Dr. Perez, but in 6 months, it would be good to see how many students we've actually can get volunteering into Dignity and potentially placed to showcase a Dignity LA Mission collaboration of sort. So I know we can't have you commit today, but something to think about, to look at 6 months from now. So yeah, those are my questions.
So let me share with you guys. With me, I started off as a coordinator and worked my way up. But let me share this: volunteering. When you're volunteering, people are watching you. People are watching your conduct. They're watching if they give you something to do, how well you do it. And that's how you really get opportunities and you move up in an organization. Of course, there are some jobs that are going to require more education. So I'm not saying that, you can move up just from hard work. It used to be that way, but some jobs require a skill or further education. But I will say that if you volunteer in any facility, a Dignity facility, which I hope that you do, but any facility, just know that people are watching your performance, and that's how people typically get offered opportunities. When you do your clinical rotation, those nurse managers know what nurses they want to bring back. They're watching you. They're watching your performance. So when you have these opportunities to either do an internship, you have an opportunity to volunteer, because let me tell you, even though you're volunteering, there are thousands of people that are trying to get into that hospital to volunteer because they see it as an entry point, okay? And in many cases, it is an entry point for a full-time position. And so if you do anything in the healthcare or hospital setting of your choice, make sure that you put your all into it, you do a great job, and you network. Networking is critical. You look at LinkedIn, you look at all the social media, networking is critical. And so I would encourage you, if there's anything that you take away from this meeting today, is that find a way to volunteer, find a way to find maybe an entry-level position, if you have the time while you're going to school in a hospital, if you're interested in going into healthcare, whatever field that you're interested in going into. Because typically, I can tell you the last organization that I was in, when we had new grad training programs or any type of internship program, we looked at our internals first. So if you are interested in nursing, or you're interested in IT, or you're interested in finance, try to get into an entry-level position, work your way up, and try to get into a volunteer position and network with the people that are decision makers. Those are our entry-level opportunities in terms of your career path. Okay?
Great, thank you. So we'll end with Dr. Perez. So, Dr. Perez, I don't know if you guys know this, so Dr. Perez is, I think, the only community college president that sits on the National Association of Workforce Boards, right? So it's kind of rare because community college CEOs and the EDs, executive directors of the workforce boards, oftentimes are talking past one another, and Dr. Perez actually has brought a common language between all these parties. So, to end on you, obviously you were a student once. You became president of LA Mission. I think in California, the rate is like less than 3% Latino presidents or so in community colleges. Similar to the silver tsunami occurring in healthcare, there is a major issue occurring in the pipeline of community college presidents. As it relates to, I want to go to college to see someone that, similar to me, that looks like me. And oftentimes you as president become the inspiration for your own students. So that's a pretty big responsibility. So, based off your experience, what is the recommended advice that you would have for students that are interested on a pathway into healthcare and may not just want to stop at being a nurse, but being a CEO, because that's how you create philanthropy and economic mobility in communities of color?
Yes, appreciate that what's going on in Dignity Health, the healthcare field, the grain, or tsunami, you called it. We have a grain tsunami with college presidents, with college leadership, not only in community colleges, but others. If you can look at sort of the ages, and I'm not trying to speak about anybody in this room except for me, we're working longer. You know, we're not retiring. We're continuing because there isn't a sort of ongoing flow of leadership that is coming our way. So there's a need for that, absolutely. When I was at UCLA Medical Center last week, I was reviewing their website and looking at the director of the entire UCLA Medical Center. It's a woman, and she has a master's in public health from UCLA, of course, but many years of experience working her way up, as Janelle has just said. And she runs UCLA Medical Center. And the regional director was my doctor. He was an internist. He is a medical doctor, but he was an internist. And so he is now in management. He still keeps a few patients. I'm no longer his patient. He moved me to another doctor who was great. He still has his hands in, but he's running all of the Southern California region of UCLA. So it's interesting how they got to where they got in the case of Masters of Public Health. Now, I got my degree at USC, that good school that you're wearing this sweatshirt there, and I got my doctorate in administration. And there was an option called hospital administration. It's still there. Healthcare administration. I didn't go in that option. I went in educational administration, and then worked my way up in the educational through Cal States and community colleges. But the point I want to make here is, I think that you have a goal. And you have the education, but I think Janelle's right. You need to put yourself out there. You start volunteering, you start becoming interns, you start working with individuals that can mentor you. And I had several mentors when I was a young, starting out in education. I had a counselor that mentored me in the Cal State system. She took me under her wing, kind of showed me how to address counseling issues, administrative issues, with regard to student outreach, with regard to student retention, how to serve veterans, how to serve disabled students. So I learned a lot from her, and then she's the one that got me involved with getting into USC doctoral program in public administration, public policy, and got me involved with that. So there's always that professor, that individual that you can work with, and you're right, Christopher, don't be afraid to ask, you know. And then finally, let me say this, is with regard to any partnerships we have with healthcare organizations or health care corporations, organizations, hospitals, clinics, and so on, like Dignity Health, we can, and I think Christopher made a real good point, we can get our career center to link with our various health, and I'm looking at my dean of CTE right now, so that we can provide those opportunities. So there's a point of contact from the college with Dignity Health or with Providence or with the UCLA Medical Center, and there's a point of contact, and clinics. We have here in Pacoima one of the most a free clinic, mobile clinic, by one of the graduates at LA Mission, who is now a dentist, but provides dental care, vision care, and a mobile truck that he has, and he takes it to different parts of San Fernando Valley and provides those services. Well, he's looking for volunteers to work with him, and he provides all kinds of screenings, a lot of assistance for individuals that can't afford it, can't afford to go and get that. Those opportunities are very much available. So to finish I would say our Career Center can be the link that can make sure we have the opportunities, make them available to our students, and we get the word out to them, and they then can get hooked up with these fine organizations.
Yeah, well,
Felix,
go ahead,
can I
sorry.
say one more thing? If we do have some aspiring CEOs out there, which I hope one day that I'm looking into the audience at some of our future CEOs in healthcare, there are programs out there, and I'd be remiss to not say what they are, but many organizations offer what we call administrative fellowship internships, and they're typically 1 to 2 year internships that they take master's prepared students to mentor to become hospital executives. And I can tell you, I had the role at one point in my career where I was over the administrative fellowship program for a large healthcare system. And I'd go around the United States. There were different schools that we targeted that had MHA programs or MBA, MPH program combinations. And we would put these students through a 1 to 2 year internship. And many of them, and this was probably about 12 years ago when I ran that program, and many of them sit on my LinkedIn, and they are COOs and CEOs of organizations today, and they're pretty young. So the sky's the limit. Don't limit yourself just to nursing or just to radiology technology or some of the different professions in healthcare, the clinical professions. The sky's the limit, and go on and pursue those executive roles, because there is a graying population. I'm one of them. I just dyed my hair for you guys. But there is a graying population out there, and don't limit yourselves. Do not limit yourselves. Don't limit yourselves.
So you've heard from the experts, that and this is a great panel. First of all, thank you so much, and Christopher, thank you for joining. I would just send on a story. So my mom is an orphan. She lost her dad when she was 4, and she's from Mexico. And her dad passed away. Her mom passed away when she was like 7, and she grew up in a foster care, getting abused. They brought her to Chicago, and then she moved to Puerto Rico, where she met my dad. And at the age of 18, they moved to New York. And so when they moved to New York, we didn't have much money, so we lived in an apartment with my grandparents. And growing up as a Mexican Puerto Rican in New York is very rare. It's like the perfect bean. And we lived in a very gang-infested neighborhood. But my mom and dad went to NYU. They got Larry Lucky in a scholarship. My mom went from being a social worker to being an MSW, being CEO of a hospital. And with barely speaking English. Like, if you speak to her, she still talks with her great accent from Guadalajara. But so there are amazing, stories. There's nothing that can stop us if we put our mind to it. The last piece I would add to that is that we're all young, and Monte as well is young as well in heart. And there's, healthcare, you don't have to just think about having a job. You can become an entrepreneur. That feeds into the healthcare system. I'm sure Janelle can tell you so many companies trying to be vendors to Janelle at Dignity Health, and there is no limitation. So, as you think about, healthcare, just, think about all the opportunities that might exist. And so, thank you very much for coming, Janelle, and we'll be around so you guys can, talk more. And thank you, Dr. Perez, for allowing us to host this.